So liaison psychiatry is about the psychiatry in the general hospital. So liaison psychiatrists work in the general hospital and they're looking very much at the interface between physical and mental health illness. So they might be seeing patients who have a medical problem on the ward or A&E possibly, but also who are presenting with some psychiatric symptoms. A typical day is really varied. It's difficult to say because referrals come in all the time. At the start of the day, you'd probably have a meeting, referrals meeting, with the rest of the team. It's important to say that you'd be working in a team with nurses, psychologists, but also the admin team. And so you'd go through what's come in and who's going to see whom. After that, you might go and see a patient. It could be an A&E, somebody who's maybe taken an overdose and assessing what's going on and trying to offer them help and support. It could be a patient, for example, in a general medical ward, maybe a patient who's had a heart attack and now is very depressed. There may be meetings during the day where you meet other medical colleagues, possibly in the hepatology or cardiology department. You might do some teaching with medical students, and then some of the time would be doing paperwork and also liaising with mental health teams in the community to get the best for the patients you're looking after. The really good things about liaison psychiatry are that you get to treat patients with both medical and physical health problems. So I was always interested in medicine, but I also love psychology and psychiatry. And dealing with the both at the same time is great. It's very varied work. You never know what comes along. It's really good if you like working in a hospital environment like me, and if you like interacting with other specialties. So meeting the surgeons, the doctors in A&E, the nurses, and working with them, which I really enjoy. Things I may not like so much about liaison psychiatry: the workload can be very heavy, it's quite varied, and at times it can be quite intense, and you can't really predict that, so it's hard sometimes to plan other things that you're doing. Another problem can be that in Britain, liaison psychiatry is quite underfunded. Some hospitals have a great liaison psychiatry department, but a lot of them don't have hardly any people working in the team, and therefore it can be quite tough. So to train and become a liaison psychiatrist, you'd need to undertake the general psychiatry training that everyone does. So for example, you do foundation program, moving on to the core psychiatry training, doing your exams. Then you would need to apply for general adult psychiatry because that's where the endorsement in liaison lies. The endorsement is basically accreditation into that branch of psychiatry and means that you'd work for a year in liaison psychiatry so you're able to work in it as a consultant in the future. I think the competition varies where you are in the country. It's probably a little bit more than when you're applying for core psychiatry training or higher training. Liaison psychiatry is expanding at the moment, so there's a lot more jobs being formed, new jobs, with the opportunity to start forming services. So now is a great time to join.